Thank you, Madam Speaker. My question is to the Premier. Premier, as you know, the Greens take responsibility as community leaders in this pandemic very seriously, and we raise concerns as necessary and always back in the advice of public health. You've taken the decision to open our borders to seasonal workers without requiring them to have strict 2-week quarantine. Understandably, some in the community are fearful of this big change to our tight borders and the potential risk of coronavirus-infected workers entering the state. Premier, how many fruit pickers are you intending to allow into Tasmania? Will you lay out the arrangements for coronavirus testing and worker isolation for these people? And how will you reassure Tasmanians there will not be any mixing between imported fruit pickers and local pickers?
Honourable the Premier.
I thank the member for Franklin for that question and for her interest, and if I could say for their support of public health throughout this period. In fact, only this morning I was being briefed by the Director of Public Health in terms of matters related to testing in our border, just to once again ensure that my understanding of the arrangements that are in place as we gradually step our way back into this suitable and importantly are going to provide the protections that we need. Now, in terms of seasonal workers, the question was how many do we expect to come into the state? Could I say as few as possible? Because I would hope that as many Tasmanians as possible put their hand up and take on board these jobs. And importantly, I would hope that Tasmanians take on board these jobs and displace the need for significant numbers, as has occurred in previous seasons in Tasmania and around the country. Because Australians and Tasmanians broadly have not been prepared to take on these jobs in the past. But as we all know, circumstances have changed, and I'm hoping that more Tasmanians will step up and take on these jobs. And so the answer to that part of the question is as few as possible, and hopefully as many Tasmanians as possible will take on that work. And we're working closely with the sector and with the industry, and the Minister has been highly engaged in terms of ensuring that we get the message out that jobs are available. Now, in terms of seasonal workers coming in, first and foremost, they will only enter the state from low-risk jurisdictions. And in entering the state, they will, the same as anyone else entering the state, now have a health check, including a temperature check at the border, and if they are symptomatic, then they will be tested, Madam Speaker. In terms of the arrangements for the first 14 days, they will need to stay either in their accommodation on farm or in their residence, and only travel between the farm and that residence, Madam Speaker. Now, importantly, and I just want to touch on the issue of testing, and this is one of the issues that I know interests a lot of people in this place and interests Tasmanians. The advice from public health in terms of why we don't test everybody at the border is that the disease is not detectable in people until it's entered the bloodstream, usually 3, 4 or 5 days after they've come into contact with somebody with the disease. And so the view of public health, and I must admit I agree with this, is that you have people that come in, they get a test at the border, and then they believe that they are COVID-free. And that increases their level of confidence to go and do things in the community that then puts other people at risk. And so public health have been very firm on that the testing at the border, Madam Speaker, can lead to the wrong outcome in that it can increase the level of confidence that people have because the disease is not detectable at that particular time. And so in terms of the workers themselves and seasonal workers and the requirements that they will be under, obviously they will be able to leave their accommodation for medical assistance or to go and purchase essential supplies. But under the terms of the direction, those seasonal workers, if they become symptomatic, if they are unwell, then they must stop work and be tested. And likewise, in terms of the COVID-safe plans that employers put in place, there is a responsibility on the employers to have a safe workplace and to ensure that the people that are working for them are healthy as well. And so there are a range of protections in place, Madam Speaker. But the key protection is that these seasonal workers will not be entering the state from hotspot areas, Victoria or other hotspots around the country. They will be coming from areas where there is a very low incidence of the disease, if any at all, and therefore, under the requirements that Public Health have laid out, I am confident that we have a framework in place that will protect Tasmanians and at the same time enable sufficient numbers of seasonal workers to come into the state that we need over and above those Tasmanians that put their hand up to do the work.